a.m. or on YouTube, channel 𝗛𝗲𝗁 8:10 a.m. Radio Bandido.
The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole, Jacinto. Join us on Healthline with 𝗵𝗏 as we discuss the latest health and medical topics with doctors from 𝗵𝗏. For a healthier and uplifting lifestyle, tune into Healthline with 𝗵𝗏 on 𝗛𝗲𝗁 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗵𝗏, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search 𝗛𝗲𝗁 Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗵𝗏 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗵𝗏. I'm your host, Nicole Jacinto. Today with us on the show, we have Dr. Donna Sarosa. She's a dermatologist or a dermatology specialist, and of course, she practices in Makati Medical Center. And we're going to talk about melanomas today, or a melanoma, or like, what is a melanoma and all that. I'll get to that right when I introduce the doctor and we begin our conversation. And of course, if you have any questions, if you have any questions that you want the doctor to answer directly, please send them in during the show. That way we can ask the doctor. And as we say, you've got questions, we've got answers. Okay, so sometimes we get questions that come in after the show, and I am not really authorized, to answer that. But if you take a look at the show, most times the questions are answered. So watch the show as many times as you want, play it over and over again on all the platforms. And today I'd like to say hello to Oma, who is watching. That's a nickname she has. Actually, it's Gina Alberto. And hello to all the other viewers and listeners of the show, and hello also to Varon, who listens on terrestrial radio, old school. I like it. Okay. Hi, Dr. Sarosa. Welcome to the show. How are you doing this afternoon?
I'm good. Good afternoon, Miss Nicole.
Good afternoon.
It's a pleasure for me to be here today with you.
Thank you very much. It's my pleasure to have you on the show and to talk about melanoma. And I'm sure from our conversation later on, I hope this serves as a platform to get, not only to inform and educate people, but to get them to, get their skin checked out by you or any other dermatologist, if there are any irregularities. Okay, so let's get to the topic. Okay, doctor, what is melanoma, or what is a melanoma? Because sometimes, I'll hear people say, "Oh my God, I went to the doctor and I have a melanoma." So what is the term? I mean, okay, first of all, what is it exactly? And then I'm sure you'll give us a brief overview, and you can tell us, if it manifests in one site or more, and the usual. Okay, thank you, doctor.
Okay. As you know, melanoma, so it's a tumor, right? So when we say melanoma, we think of a malignant tumor that's coming from the word melanoma, melanocytes. And these melanocytes are actually the cells that are responsible to make pigment. And that is what gives us color for our skin, right? So like, we call Filipinos, we're more or less in the darker skin type, and so we're called skin of color, right?
Oh, yes.
And so when you have a melanoma, this is considered like a skin cancer, and therefore there are abnormal growth of your skin cells. And these are the ones that are usually exposed to sunlight.
Okay. Thank you, doctor. So I love it when doctors like yourself use terms that explain the name. You know what we call it actually. So as you said, 𝗪𝗻, that means okay, it's a type of cancer or tumor. And then please jump in and correct me anytime. I'm just recapping what you said for my own better understanding and for those also who are watching and listening or both. And then also it's a cell you said that I guess that starts behaving in a manner that produces is it one cell or a bunch of cells? And also I'm glad you mentioned the part of because like you said it gives us pigmentation, no? It's a cell that gives us pigmentation.
Yes.
So our color. So is that like, of course, as Filipinos, as you said, we're our skin is more of color, or it's darker. So we have more melanin, right?
Correct. Yeah.
Right. And we're born. Genetics play a role in giving us the kind of, I mean, the melanin in our body and what we look, what our skin color looks like, and what comes out. And you said that when you say melanoma, that means you have some type of skin tumor or cancer, and this is because of a reaction to sunlight.
Yes.
Okay.
Yeah. So your pigment cells are reacting to the sunlight, and basically that's UVA,
Okay.
ultraviolet light A. So of course, sunlight has many gradients, but UVA is more prominent at a certain time of the day. But in general, it's exposure to sunlight that can actually aggravate the skin, right? So we know that, diba, we can get sunburn, right, from too much exposure from the sun.
Yes.
But for us, let's say for Filipinos or Asians, what happens is instead of getting a sunburn, most will get like they're just going to get like darker color
Because
as compared, yes, as compared to, let's say, Americans, Caucasians, or Australians who have very white skin, fair skin, and what happens is they will get a burn because they don't have that protection also, because in a way, our melanin, okay, is what gives us protection from sunlight.
All right.
That's an advantage. That's very fortunate that we Filipinos have already that extra protection.
Yes, especially considering that, well, I don't know if it's interrelated throughout, but also because of we are much more exposed to sunlight here, and all throughout the year, and especially if you work outside and you're, let's say you're a farmer or a planter, you really are, bathing in the sun for most of the day. And that way it can protect you. You mentioned that, yes, Caucasians are probably more. So are you saying that sorry, okay, let me phrase that as a question. Are you saying that Caucasians are more at risk for melanomas than people of darker skin color?
Yes, this is actually a fact already. Genetics actually plays a role. Number one, family history. So you have to ask, just like any cancer, diba? You ask if there's a family history of skin cancer. Like in other cancers, we also ask like breast or lung cancer. That's part of the history. Of course, when you have a family history of skin cancer, then it increases. Then if you also have a light colored skin, because you don't have that much protection, right? And if you also have lighter skin, we notice that they also have a tendency to burn. So these are the patients who have high risk of developing melanoma. We also usually say it's easier for us when the patient comes in, like Americans, Caucasians, if they're blonde, blue-eyed, red hair, I mean,
Yes.
the real red hair, hindi yung colored red hair.
Yes, yes. You have to make that clear nowadays. Yes, yes.
Yes. Kasi ang daming blonde dyan, di ba?
Yeah. But may I say, I am a pioneer of the red hair. Okay, but I know, yes, especially the younger kids. Oh, okay, yes. There's a lot of blonde, not naturally blonde, and
Yes.
not naturally Red-headed. Okay. So go ahead, doctor. You were saying, yeah, that plays a factor in it. Can I ask you about just off the cuff thought? Before there was any talk that I'd hear about this, a lot of people are fond of going sun. They were a lot. Well, I still know a lot of people who are, let's say, white or Caucasian who love to go sun tanning or to go sunning themselves. And I remember when I was a kid, we never even heard of we can circle back to this topic later, but we never even heard of like sunblock or any of that. And it was suntan oil. Would you happen to know anything about like to make yourself darker, and then they would actually, some of them would get a tan, but yeah, they were red a lot. Or they would say, oh, I'm not going to burn. I'm not going to turn red. I'm just going to get darker because I want a suntan. So the sun tanning lotion, I mean, maybe not in its form before or today, does it, let's say you don't want to be as white and you want to get a suntan, does it protect you from the sun? We're not talking about sunblock, just sun tanning lotion.
Yeah, it actually gives you a false protection. Yes. So it's not, in fact, it's not anymore recommended to do this tanning things. I think it's not so popular maybe in our culture. Remember, amongst Filipinos, they like to be white, right?
There's
but you don't have to like, right?
Yeah.
So they're actually at risk, no? Because it gives them a false sense of protection.
All right. Yeah, I do remember a lot of the lighter skinned people, even family members who were lighter skinned, putting suntan lotion. And I kind of like to get a tan. And most of the people I know like to get a tan. But then there's also the other side where most Filipinos would prefer to be lighter. Maybe it's kind of like the grass is greener, no? You don't.
Yes, but I think now, I mean, maybe those who like to get the tan, very popular now is bronzers, right? I mean, we have cosmetics that for those who like to have that shade, then they use the bronzers. I think that's safer because that's just makeup. That's just a cosmetic. And doesn't give you false protection.
I actually know about bronzers, but as if you ask anyone who knows me, I'm not a makeup girl at all. So I'm sure that if I visit you, actually you can probably see now, I'm sure you want to do things to my face and poke it and take out blackheads and all that. Yes, I have not been to a derma since before COVID, but it's probably time. Okay, but back to the topic, doctor. All right. Sorry, I tend to go off on a tangent, which is still related, but somehow, all right. So melanoma is a cancer, and how is it different from other skin cancers? And are there stages? Are there, how do you define it? It's as a type of skin cancer. Is it because there's some kind of a tumor, or because it can also invade the rest of your cells and cause damage? And what are the other skin cancers that we're talking about then? Because people will say, I have skin cancer, or so and so had skin cancer, and some people will be like, oh, it's just skin cancer. It's not just skin cancer, is it, doctor? No, it can be. Tell us how serious it can get, what the best case scenario is to the worst case scenario, and how is it different from other types of skin cancers? Because we tend to mix terms a lot when we talk generally, but you would know the difference.
Okay, so let's start off with clearing what is melanoma. So I said it's pigment cells. So in your skin, basically, let's say when you have a nevus, like a mole, right? So that's a pigmented lesion. So that has color. And that's what you watch out for, right? So that's where actually sometimes melanoma arises. So you look at the mole. So that's very simple. For a layperson, if you have a mole, check for that mole. So it's like a mole check that you're doing, right? And then you see changes in that mole. then it's more like when we want to look at melanomas, it's more what we call preventive detection. So you already prevent it before it even worsens. Okay, just like any other thing. But there are many kinds. So we also have other skin cancers that we call in our field. There's what we call squamous cell carcinoma. There's also a basal cell carcinoma, and this arises also from maybe a mole that changes, that gets what we call ulcerated or bloody or very big, or it changes in size. Okay, so it's hard to like classify all the kinds of skin cancers. It's like it's a whole session. It's
The
like,
whole session, but
yes.
in order to define what melanoma is, it's definitely
Yes.
it's because of the pigmentation, and you look at moles.
Yes. So if I want to simplify it for the lay, I just say, okay, if you have any pigment anywhere else in your body, then we check if it's a mole, or if it's a wart, or like any other thing. It can also be, we have things like like change in pigment because of trauma. Okay, so the color will also change, right? But basically, what we see also here in the hospital or in our clinics is patients would come in and they will say, I have a mole. I've heard, or I'm scared because I've heard, like my friend, she developed skin cancer and it started from a mole that was there, right? And so the basic thing is to look for changes.
Changes in an existing mole. How about moles that appear? I mean, because what did I remember? I remember a long time ago, like one of us got interested in. I guess I have strange relatives and friends, but we should really check out our moles. Of course, we don't know what to exactly check out, but let's count our moles and see if we get new ones. So we counted like, oh, I have 41 moles on my body. I have this or I have that. And then what happened to my mole here? Or, no, that was a freckle when you were a kid, So like if new moles appear, is that do new moles even appear? Or are we born with all of them and we just see them? Or if there's a change already, like let's say you're of a certain age and like, what? I never noticed this mole before, or this freckle, and what's the difference between a freckle and?
Yeah, there's actually there's a congenitally acquired, so that's at birth, right? So it's already like a birthmark, right? We call that genital melanocytic nevus, and then you have acquired. So as you get older, most kids don't have moles, and then as they get older, they'll suddenly say, oh, I never had this. Why is it in my face, or it's in my body, right? So those are acquired. But moles are predestined. And so eventually they will appear. And because of sun exposure or chronic sun exposure, it has been discovered that they change over time, right? And develop these abnormalities. And so we always have, if you're in elementary, what are the basic is ABC, right?
Yes.
You learn the alphabet. And when we look also at moles, we also have ABCD.
ABCD.
Yes. So at least for the lay, this is something that they should know. And this is actually, we used to have posters and leaflets to warn the public that this is what they should see, because we can't examine everyone.
Symptoms.
Yeah.
So okay. Go ahead.
So let's say for A, it's asymmetry. So when you look at the mole, is it round, well-rounded, or is there like a different size to it? Is one edge, like uneven? And then B is for border. Again, if you see some rugaes, like they're very circular, some will have a ragged edge. And then C,
the edges of the mole.
Yes, edges of the mole. Yes, so that's something, because it's difficult to monitor if there are edges, right? And then C is for color. Most molds will have one or two colors, like brown or black, brown, black. But when you have three or more colors, then that's something that you have to be suspicious of. And then D is diameter. So when it's greater than 5 millimeters. So that's half a centimeter.
Okay. Thank you for
molds, yeah, you have to watch out for. And then E, A, B, C, D, E means there's an evolution. So over time, it changes. And therefore, if you're going to ask me, when is the best time to check these molds? If you have a high incidence of developing melanoma or skin cancer in your family, at least a yearly check, especially for those who have higher incidence, like as I said, blonde, blue-eyed, and who are chronically exposed to the sun and do not protect themselves at all.
Yes. I mean, that would be probably people like when you talk about protection, do you mean like, let's say, many things like I don't know, visors, hats, sunblock, or I'm just saying general sunblock, because I don't want to mention any brands. Not that I would know a lot of them. At this point. Okay, but
You're correct, but the correct term is actually, we're trying to use now the word sunscreen.
sunscreen, yes. Okay,
Yeah.
maybe that was a name, from a long time ago.
Yes.
Yeah, okay.
So, but I think basic for sunscreen, I mean, for also our listeners out there, at least an SPF, sun protective factor 30, and then the 2 mineral sunscreens, which is safe. Okay, it's is titanium dioxide and zinc oxide. So those are the things that you should look out for in the ingredients of your sunscreen. And I warn these to my patients because there's so much available that they can buy online, right? And they have this misconception. Some will label them as giving them a sun protective factor of 120.
Yes, I was going to ask you about that. What is this? Because I remember before SPF. Yeah, I lived abroad, so I would see this in places anywhere, like in a in drugstore. You're there to pick up gum or whatever, and you go on a trip, and then okay, we were told to wear sunscreen, and there's SPF 30, and then I'm like, recently. Somebody recently, meaning like 2 years ago, somebody said, this is SPF 100. I'm like, what? It's gone up to that much? You mean we weren't protected before? So can you delve into that a little bit more, doctor, since you mentioned it already?
Okay. Okay. For us, like for our skin type, a good enough is an sun protective factor of 30. Nowadays, the FDA, we're following the US, they're not anymore allowing, at least they're trying to remove in their shelves anything above 50. So the correct label for all basically is SPF 50 plus. They can't go any more beyond that number because beyond that number, it gives you a false protection that, oh, I'll get the higher number, right? The higher the number, the more protection. But in reality, you basically have to apply, if you're really outdoors, every 1 to 2 hours, you have to apply your sunscreen there. So at least basic, just learn SPF 30 to SPF 50. You should be okay.
Yeah, so thank you, doctor. I mean, that's a good and strong message, and I'd like to highlight that, especially as you said, a lot of things are available online. And you did mention that the things to look for are zinc oxide and titanium oxide are all right.
Titanium dioxide.
Sorry, titanium dioxide. So okay, let's not get into chemistry now, Nicole. Okay, so two of this chemical, and all right. So, why those two, and are there like countless others that can also harm when we talk about protection? Like you were talking about giving us say labeling something as SPF 100 and 50 as giving a false sense of protection. What about other ingredients in sunscreen?
Okay, I won't delve anymore as you were saying chemistry, no? But
Yeah.
those two things that I mentioned, they're actually mineral sunscreen. So
Okay.
what happens is when you're going to put your sunscreen, okay, the minute you put your sunscreen, they're already protecting you from UV rays. Okay, the other kinds of sunscreen, whatever it is that they have, it takes 30 minutes before you're protected. They're called chemical sunscreens. So it's not an immediate protection. Plus, these mineral sunscreens are very safe also for the environment and for like reef friendly. So for our animals in the ocean and the environment, basically.
Thank you, doctor. And at least they're probably you're right. Somebody could just put it on and go into the sun immediately.
Yes.
By the way, what's the right, or maybe I could circle back to this later. I don't know, but while we're already here, what's the right amount to put? And like where? Like, okay, for example, here in Metro Manila, it is sunny. And I noticed that I've been sunning my feet because they hurt and it worked. But except I wear slippers and now there's a slipper strap, there's a tan line um on my feet. But okay, so like what's the right amount of sunscreen to put? And also I wanted to ask you more about sunscreen because I've heard of things where, oh, I'm using this for my face and this for my body. If it's good enough for your body, is it good enough for your face? Or, is that true? Or, I mean, like, is that a marketing trick? Like, this is for my face and this is for my body.
I agree. It's more like a marketing thing because you look at the ingredient. So now the amount of sunscreen is actually they do recommend. Now, let's say for the face, you'll be surprised. It's half a jigger. So you know how a jigger, yeah. So to cover and get that enough protection. So you know that what you're putting, let's say it's an SPF 50 and you're not using half a jigger. So maybe you're just putting in an SPF, you just have like a 25 protection, correct? Because it's not the full amount that you're putting. And or else you'll be very white. We call them kabuki white.
Yes,
although,
that's right.
although nowadays there are all these cosmetics and all these companies, they make it in such a way that you have tinted sunscreen. So, or they have what we call micronized zinc oxide. So they're very pleasing, they're not sticky. So it has to be pleasant for us to use it, right? And so if you're only putting enough, let's say you're not using half a jigger for, let's say, for your face, it's not that thick enough, then that's why we also have makeups that you can also put. You work together also with your powder. So your powder may also have an additional SPF. So then that's an added factor that you can do.
So the fact that makeup can protect you from the sun is true. But it depends on what you get, I guess, because not all makeup is made the same and equal, I imagine. Because again, I don't wear makeup, but I do know about these things, girls. I mean, I just found it too difficult, to really learn. And then I was like, never mind. But, sometimes I even coach people. No, you have to put that. How do you know that, Nicole? Well, I have sisters and stuff. And
I think, I actually teach patients on how to read ingredients. So if they buy things online, they're not misled. Kasi nowadays, diba? I mean, it's so popular. They'll say, oh, my friend used this, or they saw it on Reel, or they saw it on TikTok, and it was very popular. But you have to know what you're putting. Because there was a time that certain cosmetics or even sunscreens had mercury in it.
Lovely.
That can be very toxic to the body. Yes.
Yes, doctor. And even when you get it in person, you really should read the ingredients. I mean, you could be allergic to something there, and that's why you're breaking out. It could be as simple as, say, a small allergy that makes it inconvenient for you for a time, and it can be as deadly as you said, mercury. And uh, also the source. I mean, I bet you some indiscriminate manufacturers in this day and age do not even put all of the ingredients in their products.
Correct. So
So
it's
and
a warning to the public that you should buy from very reputable companies. Like not a fly-by-night thing, because it's your face. And even if you say it's just on the skin, everything will eventually be absorbed by the body.
and by the way, doctor was saying, so it's half a jigger usually for the face. And for those of you who don't drink or did or like what do you call this, amateur bartenders, or like I used to be, that's like a shot glass or
Yeah.
half a
So
okay,
that's how much. Around that's 2 tablespoons.
2 tablespoons
Yeah.
of
Yeah, that's around 2 tablespoons for the face. So
okay.
nobody put that much, or your whole supply. You're going to consume your sunscreen in what, maybe 4 or 5 days.
Yeah,
Yeah.
that's right. Yeah. And then what about for the body, the other parts of the body, like let's say the hands and the arms, or
Oh,
mm,
it's enough that you cover. And also, that clothing has already an SPF of around 6 to 15. So that's an added protection as well, especially the longer knit. That's why, you cover up, you wear your shades, cover with a cap. And
yes.
we really give this advice, especially for younger patients, like for those 6 months and below, where,
Mhm.
of course, the recommendation of sunscreen is 6 months and above. And then mommy will come to the clinic and ask, can my child go swimming, or, just playing in the water? And we tell them to, cover up the child. So put a cap, okay, and then cover them up. That's why we have already rash guards now also available that can give you already an SPF 50. So if you're
I
about to put your sunscreen, you just wear a good reputable rash guard as well.
Okay. Or like just don't take off your clothes. I'm just kidding. Is okay. So doctor, we're talking about, protection from the sun and all of that. And we did mention, I mean, that it's because of exposure to the sun. And you did mention earlier that for darker people with darker skin color, and if you will, so most Filipinos are I would say we come in all shapes, sizes, and colors. Filipinos, we really are a melting pot. No, when it comes, but there are many who are also really darker skinned, even So when it comes to that, how common is skin cancer in the Philippines? Because as you said, if being Caucasian, or being white or having lighter skin puts you more at risk, then and having more melanin in your system gives you more protection. How common is it? How, and also from from your practice, like what you've seen, how common is skin cancer or melanoma, that type of skin cancer in Filipinos?
Okay, there's already a rising incidence, no? Maybe not the classic superficial spreading melanoma. That's a variant, no, of melanoma that's very common, and this is due to sun exposure. But we have the acral type of lentiginous melanoma. So these are found on hidden areas. And incidence total, maybe I'll say just in general, in Asians, it's much higher. That's 29 to 46%. Although this is more seen in the older population. So some people may mistake it for like a wart on the foot, or maybe like, they traumatize and then they don't see that there's a pigment change there. And therefore, that's why it's very important that we really do a total body check, especially any pigment in our skin.
So guys, I mean, I recommend, like, I just recommend that I can recommend you go to a doctor and do a total body check. But if you want to start checking each other out, like it was like my cousins and my sisters and I, let me look at your body now. Let me know. Okay, you have how many moles? I mean, it can be as innocent as that, or it can be something you do on a girls' night or whatever, as it is. So total body check, but with a doctor is best because you might start panicking. Oh my God, that's mole, that mole. But doctor, you mentioned interestingly, you said there's a higher incidence in hidden areas. If
Yeah.
can you clarify what those hidden areas are, maybe around the body, and if it's hidden, does it get exposed to the sun? I mean, how does it come into play?
So these these variants are the ones that are not exposed to the sun. Remember, the ones that we see more in lighter skin,
Yes.
more commonly, it's due to sun exposure, no? But amongst Asians, these are the ones that are hidden. And may I tell you that recently, Makati Medical Center has acquired, a machine. It's called a total body mapping, where we check every, like you were saying, you just check each other's moles, but
Yeah.
who knows, a blind is leading a blind, right? I mean,
Yes.
how would you know? You're just counting the moles, but you're not looking at each one. So we have this, it's called a dermoscopy. And a dermoscopy is actually a non-invasive tool where we can diagnose if a pigment has an increased incidence of developing melanoma. And therefore, so that's where preventive detection already plays a role. And we have the capacity, just like how we do it. And I'm proud to say that we're the only hospital now who carries this machine, and it's called total body mapping. So you examine everything from the scalp, face, the entire body, the
If you
hidden
get the
areas, including the
scalp,
soles.
including the soles. Okay. I have
Yes.
like I don't know if it's a mole or something, but it's been a long time, and on the underneath the lower part of my toe. I really
Okay.
don't know if it's a mole, because I know like 20 years ago I tried to dig it out. I thought it was dirt, and then I'm like, my God, I cut so deep into my skin and I can't walk now. It must be a mole or something. But anyway, I would recommend the total body mapping, or the dermoscopy, or the total body mapping scan over girls' night out, checking out each other's moles. Definitely, doctor. And the doctor, like you, can supervise it, right? And you tell us,
Yes.
what does the scan like consist of? Do you just lie down there? You say, how long does it take? Are there any special preparations?
No special preparation. We actually have, it's done in a room, okay? And of course, we examine every part. If you're a little uncomfortable being naked in front of somebody, okay, we do it per area, just like how you would do an X-ray, right? But this
Yes.
time, it's like your skin, of course, has to be exposed. You shouldn't have any clothing, okay? But we do it per area, like, and then um, and then right there and then, there's already a pathologist who will actually explain to you. So most of our patients are actually sometimes worried about a single lesion. And if you're worried, do not ignore that. So it has to be seen. And what we used to do before was, if something was suspicious, we would already cut out the skin, like do a biopsy, a small piece, punch a hole, a 3 millimeter, maybe on the edge, no, and then have it read by a pathologist. But nowadays, it's a non-invasive thing. And instead of having, being cut everywhere, it's a tool, and it's very sensitive. Of course, there's also some artificial intelligence technology that goes with it, no? But at the same time, there's still a professional, a
Okay.
dermatopathologist, who will read it for you.
All right. Because, the machines are taking over. Just kidding. Terminator. Okay. Okay. So, doctor, when you were talking about the higher incidence in hidden areas and and all of that. You'd mentioned you're seeing it more in the elderly. Why is that? Is it because they've been exposed to the sun longer? And then we also hear, of course, that our elderly should get some more sunlight, or the time for the good kind of sunlight. Maybe you can tell us that again on the show. So for their bones and for other to get vitamin D, or to have vitamin D activated within the body, or also just for better sleep cycles and all that. Can you tell us about that, and why is it in the elderly, even if it's in these hidden areas that are not exposed to the sun? Why is it a higher incidence in the elderly? What are your perhaps theories, or actually things that you know why it's more prominent that you're seeing it there? You also did mention you think it's a lesion or a traumatized. So.
Yeah. Well, in the elderly, that's how they have just discovered that lentigines, the type that we see in Asians, we don't usually see it in teenagers. It will be in the older population. Now, for whatever reason, that hasn't yet been discovered. Maybe the pathway as they get older. It's like, of course, like tumor cells. Body also, diba, weakens as we get older. Not all our cells are the same. And also, what was the other question that you asked?
I'm sorry. When you say traumatized, just want to make it clear. If you have a mole or some kind of skin, some mark on your skin, when you say traumatized, you did mention, because it's, sometimes you don't notice it, that it's traumatized. Do you mean like it's hit or wounded or something? Just for the public.
Yeah. Oh, okay.
Trauma means, yeah.
Okay. You can also get melanoma on the nails. And that is very common, that you have to be able to differentiate if it's, like trauma from running, from your footwear, or is it really a beginning melanoma also? And we have signs that can also give us clues of having a melanoma on the nail, because you can have like, if it's blood that has clotted, right? It can mimic a mole.
Yes.
Then, of course, we check the patient again after 2 weeks. So you see that the mole is moving because the nail is growing.
Yes, the nail's growing, yeah.
Out, right? And then sometimes we also have signs that we call Hutchinson sign, where there's maybe how would I describe it? Like on the cuticle area of the nail, you see pigment. Okay. Normally, that's also a bad sign. But that can also be checked with our dermographics machine that we also have in the Skin and Laser Hub of Makati Medical Center. Yes, so instead of punching a hole on the nail, you can have this non-invasive, technique. So if you're worried about a change of color as well on your nail.
Doctor, yeah, those of us who are not doctors tend to forget that the nails are part of the skin and part of what you cover also.
Yes.
And just to make it clearer to people, because, sometimes on your nails, you'll see like a white spot. That's not it. That's not usually it. And then as it grows out, and they say, oh, that's some kind of deficiency, vitamin deficiency that you have. Some people would say that before, or sometimes people will get like fungus in their nails from washing their hands, but not being able to dry it properly, and then it's humid.
Correct.
And when you talk about trauma in medical terms, it's like a wound. And as you say, let's say you went running, and then, so let's talk about toenails first. I actually have seen like some pretty bad toenails, not mine, but I won't mention you. But I mean, because it was from I guess, like, perhaps the shoe size was too small for the foot, and maybe playing sports and all that. But then, yeah, it is important to have those checked out, because it's not as simple as actually it could be, as you said, like the blood clotted. But what if it's not growing out? And
Yeah. Yes.
people will have like a dead nail. Um,
If it's a dead nail, then you're going to see that it's going to grow out.
okay. Yeah, but this guy had it for like years, and then I finally scared him because his wife was like, "I just want to go down." She's like, "You know what? That could just detach from your body. It could, and then it won't grow back anymore. You're just gonna stop growing a nail because it's not getting enough blood supply." Then, well, his dead toe was fixed, but it thankfully it wasn't melanoma. But that's the kind of trauma you mean.
Yes. I mean, it can mislead you, right? So if you're not sure, then
Yes.
it has to be checked by the doctor. I know your other question was on vitamin D.
Ah, yes, vitamin D, yes, for our elderly going.
Yeah.
Thank you for remembering for me. My job, but you did it today. Thank you.
That's a very good question because what's the best time for sun exposure? It's still between 7 to, we used to say 10, but
Yeah.
10 can be very hot already. So maybe 9 to 9:30.
Okay.
Okay.
And then,
And then, just to remind everyone that as Filipinos, we're darker skin type, so we cannot convert actually that much vitamin D, and that's why we need to take supplements. Okay, and we have also parameters to check how bad our levels are of vitamin D. So when you have low vitamin D, then that's when you can take supplements.
okay, and you can get a blood test to check if you to check your calcium, if you have a calcium deficiency or not. And those supplements are, well, I guess, doctor, if you is vitamin D something you're concerned about as a dermatologist?
Very much.
Very much.
Yes, yes. So the basic or the what they say is for vitamin D, we must take 2,000 IU daily, at least, for those 9 to 90 years of age.
9 to 90, okay. And what is D3? Is it like the vehicle that vitamin D uses? So vitamin D would be like calcium or any type of calcium made from, okay, never mind. I might say a name and I'm not supposed to, like, well, I don't want to, but if you guys want to sponsor us, go ahead. And, so there's vitamin D, and then there's or calcium, and there's vitamin D3. Some people will just take vitamin D3, but how can you, since you're concerned about vitamin D also in patients, like, what's the difference with the two? Do they work together hand in hand, or can you just interchange one for the other?
Basically, it's the 𝗠𝗸𝗁, the D3 that we take, no? So when you buy it's the D3 level, and even when we're checking, it's the D3 levels that we're really checking.
Okay, all right. So it's okay to take D3.
Yes.
So who is the one who told me that it's the vehicle to think that person is an ortho? Very bad, doctor. Very bad. Doesn't work in your hospital though. Okay. So all right. So thank you for remembering that question, because we will hear that, and we are told that you will hear that a lot, and we are told that. But thank you for letting I did not know. Okay, as Filipinos with our darker skin color, we can't convert vitamin D from the sunlight, as we can't convert it as much into vitamin D. So if we do need supplements, there you go. That's it. Like, we don't have to be baking in the sun. Actually,
Correct.
you said earlier that my feet, I'm just like, I put it out in the sun because I'm like, please, heat, act like some kind of it's like I want to stick my feet in hot water. So and like 15 minutes in the morning, then I'm like, oh, my feet got a tan. So I'm so weird. But anyway, doctor, so we're talking about melanoma, and you've enlightened us so much on other things that we have to know before we even, like, panic about it, and just so that we know that we have it. We could get this dermatography or body screening, and we could also just go to a doctor like yourself who can tell. who can tell the difference, if our moles or anything are okay, that doesn't look normal. Let's have you do how do you diagnose it then? If before you used to put a hole, used to punch a hole in it, or it's on the nail and you used to get cut out part of the nail. Let's say a patient goes to you and they have a suspicious looking mole because the mole has just committed a crime. So it's suspicious looking, and they go to you. And then, I mean, how do you diagnose it nowadays? Can you? I'm sure there is part of you that can tell. I mean, I'm sure you can tell from the naked eye, like, okay, that's not right. We have to check it out. But is this scan now part of your diagnosis, or do you still use the traditional way? Do you take blood tests? Like, how? Just very briefly, how do you diagnose it, and then up to what point do you say na okay, you have cancer?
Okay, so of course, it's very difficult just with the naked eye, right? But following the ABCDE, then you already have a suspicion, right? And then it's already basic in our specialty that, well, during my time, it was not yet part, right? But nowadays it is. It's called dermoscopy. So we already have that handheld microscope, right? So we look at it, it's 10 times magnification. That will already give you a clue if a mole looks suspicious. And then you can take already a picture, put it in your record, and then now, as I was telling you, the total body mapping, the dermographics, is not only 10 times, it's already 100 times magnification. So you don't have to cut out or punch a hole anymore in the patient. Now, not everybody also can go maybe for these dermographics if they're not, if they can't come to Makati Medical Center. But the other thing that other doctors will do is if a mole is suspicious and maybe the patient is still hesitant with doing a biopsy, then you can take a photo, then observe it, no? Maybe put it in your record as well, and then check again after 1 to 2 months. Not after a year. If a mole is suspicious, then you see, is there an evolution? Does it seem that it's changing? No, because any suspicious mole, then it has to be looked into.
Okay. Doctor, there are also apps, I understand, that have been around for a while on the phone where you can take a picture of your mole. But of course, only a doctor like yourself can say, okay, that doesn't look right, no, if it's magnified. So what do you think of these apps? Can they use them, but also use them in conjunction with a doctor and not just be like, oh, okay, it says I have it or it says I don't have it?
Well, for me, the apps are good for documentation. You have a baseline of how the mole is. And then during the pandemic, this was very helpful because you can do actually a teleconsult. And then from there, the doctor then can decide, is it, because it still has to be seen by a doctor. The doctor will decide, does it look good or does it look suspicious?
Yes. Okay.
And that requires training. It's not we can't do this also. It requires maybe a number of years that you've been seeing moles. And once you see a mole, you'll say, oh, this doesn't look good.
It requires training and experience, and
yes.
Take down the history of your patient, and all those things click and come into place. It still requires a human being, and a trained human being, not just an app. But the apps can really help with documentation there, as you said. And doctor, okay, when you talk about checkups with dermatologists, and I remember bringing dermas, actually my mother did a lot of this, bringing them out I mean to people who don't really have access to dermas, because people think, oh, it's just a beauty thing. But no, it's not just about beauty or beautifying yourself. I mean, there you can treat some allergies, you can refer, you can, as you said very clearly, you can diagnose if there's a melanoma. There are different things. I mean, you you can address all of these other health issues. How important are regular checkups? And then what are some of the misconceptions? Or I guess this is another question that you'd like to dispel about melanomas.
Okay, so, well, misconception is number one, let's say maybe what they used to know is if you have a funny mole or a suspicious mole, then it has to be removed. So nowadays, okay, you can do conservative, right? And then we were also talking earlier about sunscreens.
Yes.
One very common misconception is that on a cloudy day, oh, it's raining, there's a typhoon, okay? It's cloudy, it's covered by, there's no sun, and they won't wear their sunscreen. So you still have to wear your sunscreen even on a cloudy day, no? What other things? Maybe also dark skin. We were talking also earlier that dark skinned men or women are not at risk of sun damage and skin cancer. So that's also false. So everybody can have the risk of having skin cancer or even a melanoma. And what we have to remember also with melanomas is it goes beyond the skin. So you can have the tumor can actually spread to the other parts, so you can have metastasis. And it's the melanoma that can really metastasize to the other organs. Yeah. So that's something that we have, and this can be prevented by early detection.
And when you talk about early detection, doctor, like how often would you say someone should go? What if they've never gone or they just want to get a checkup and then you clear them? Is that it for life, or should they come back, or what are your recommendations for that? Obviously, if there's something suspicious, then they will keep going to you and you will tell a patient come back every so often, or do this scan every so often. But for someone who's, let's say, gone to, I just want to go to the derm, get a good check and see if I have healthy skin and see if and ask why hair is growing through the mole. Okay, I don't have that. I just have moles. But some people get really conscious about that, right? And then, if they have these questions, like if you say, okay, you're clear, you're fine. Should they never ever check again? And should they just monitor themselves?
Yes. Actually, maybe the time frame that I would give is a year. No. But the problem is sometimes if the lesion or the mole, let's say the mole or the pigment is at the back or in the butt, they can't see it or nobody can watch it out for them. Like, so they, unless they have, of course, they can document. Now we can document with our phones and then let somebody take a photo and then check, right? But basically it's watching for those changes. So there's no time frame because sometimes moles can just change. And therefore, it's really being very observant on any changes of any of our moles.
Thank you, doctor. I'm told we are running out of time. Thank you for being on the show. I had a good time talking to you. I hope you'll come back on the show. Talk to us more, talk to me more. And I would probably, if I could ask for your number, I'll ask if so that I can maybe send some people your way, if you don't mind. And I'd love to hear more about any other topic you'd like to talk about. And maybe you can educate me on a lot of stuff that has to do with the skin, and not just the skin, but everything else that the skin plays into. It is the biggest organ, of course, in the body. Okay, thank you so much, doctor. Thank you for being on the show. Is there anything you'd like to say as a parting words, or say hi to anyone?
Well, I would like to, those who are not aware, we have the Skin and Laser Hub Center. So we have there, it's called the 𝗪𝗪𝗪𝗪. That's the one that does the total body mapping. And this is in the 7th floor at the Ayala North Exchange Center. It's connected actually to Makati Medical Center. It's an offshoot. We also have some laboratories there. And also we have our laser center there, where we have for, tightening, we have for pigment removal. If you have a freckle, you mentioned earlier, a freckle or a melasma that you're very concerned about, or you also want it removed. And also in our center here, so we have many services that we can offer. We also have our phototherapy center, maybe another time. And I think it talked about also in your previous shows, right? Our phototherapy center.
Come back and let's talk about it again. Okay.
Yeah.
Thank
Sure.
you. Okay. Bye, doctor. Thank you. And bye, folks. We'll see you next week on Healthline with Makati Med. Stay tuned for Kakampi Bernard Tan. Okay. Bye, everybody. See you next week on Healthline with Makati Med.
Okay.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.